is you have evaluate treat orders, you know, he presents with this, this, and this, what's your appropriate action? So during your intervention, Fred, you know, starts complaining of blah, 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 blah. What is the appropriate course of action? Yeah. So Fred says his back hurts. He has a drain in the shunt. Can you lay him down flat? Yeah. So, you know, things along those lines.
Earlier when we were discussing the flexion over 90 degrees with the hip, is that only in that sideline position since they're like already inverted almost, or is that any time?
Really anytime, because the whole mechanism of that is, so if I'm over 90, the dural sheath is pulled taut. So if you imagine if I was sitting on here, here. I spark. So here's the whole dural sheath of the spinal column. It's up here. So if I'm here, there's slack in it, right? Okay, now if I bend and I bend here, you see how that pulls tension? So I'm getting neurotension, but I'm also compressing that space, and it's going to increase my pressure. So yeah, so it's most commonly in sideline that you will see that because that's this fetal position, but it can also be in.
You need to keep in mind that during
Yeah. And the thing is, people will self-correct because they actually almost instinctively know, like, oh, that didn't feel so good, something felt off. And so even though they're cognitively impaired, it's just kind of interesting that they actually self-correct it because it just doesn't feel, it triggers sometimes it just doesn't feel right to them like that. But also, you know, presentation of primitive reflexing is something to be mindful of as well. So remember your primitive reflexes from whatever that course is you had last summer with Ingrid. Yeah, that thing, yeah. I don't teach it, so I don't know the course. Anyway, if you are working with somebody and you brush their face and all of a sudden they're like wanting to suck your fingers, that's a rooting reflex. That's the prompting of that gives you a big like, oh, you know, what is going on, and possibly that there is some intercranial swelling and making that reflex go there. Screening for those cranial nerves and knowing are they being compressed at the brainstem, monitoring your vitals. All those are things to bring forward with that. Anybody take the quiz that I put up on the cases?
What is that?
What?
What is
Next
that?
week, before the exam. I gave like a week to do it, and there's 2 attempts and things on
Is
there.
there going to be another quiz as well for this?
Yeah, I'll put that up. Yeah, so you can use those as templates to study. I just have to release the one for that. But so with regard to the week 1, the quiz will give you a pretty good idea of what I'm looking at as far as any questions that may be on the exam for that. They're going to be, you know, again, what is the movement impairment presentation? And we started with those cases because those are, so if somebody has a brain tumor, they may present with hemiparesis, so those still apply. So that was a way of like showing you, you know, refreshing that system to you and thinking about, you know, if they have hypertonicity, then it's probably fractionated movements, or if it's flaccid, then it's a forced production. Or in these cases, like so Alzheimer's, what do you think one of those categories might be that you would see, especially if it's an early onset? So, okay, so that's not a movement impairment category, so which one of the categories would you think? Bless you. Thank you. Now you might see, you know, if we go through the movement continuum, you might see their difficulty, their inability to coordinate and sequence with that. it problem solve that sequencing, but which one of those, let's see here. Here you are. So these clinical manifestations, which of these things here, which one might fit into one of those movement impairment categories? Yeah, so that's those proprioception deficits, right? So maybe there might be a question regarding Alzheimer's, regarding movement impairment, that's probably gonna point in that direction. So, that makes sense? So that's how you're gonna bring those concepts all together, like that. So yeah. Wonder if Dr. O'Shea coming back? Did they just run away?
They all went home.
They all went home? So, well, take a small break and then come back and we'll review this other handout.